Hello, I'm Dr. Butterfield from Nampa Naturopathic Health Clinic, and I want to talk to you about influenza and COVID-19. So right now, flu is the flavor of the week. That's what everyone's getting. Not as much attention on COVID this year, but sometimes they go back and forth, and really they have a lot in common, a lot of symptoms in common. They're completely different viruses, but a lot of similar symptoms, so I really felt they'd be better to handle them together. So first, let's cover the flu, common symptoms of the flu. You're going to have fever and chills, cough, headache, muscle aches, feeling very tired, weak, sweating, and chills. Okay? With children, it might be like fussy, irritable. They might be more likely to have ear pain, stomach, vomit, diarrhea, that sort of thing. Okay? Let's look at the COVID symptoms. And notice that they're very similar. Okay, so we got dry cough, shortness of breath, extreme tiredness, fatigue. You can have more digestive symptoms with COVID-19. I should distinguish real quick. There's kind of influenza, which is a respiratory virus, and then there's the stomach flu, which is really a different thing. I'm going to handle that in another video. Okay, let's go back to COVID-19. You can have pain, headaches, body aches, fever and chills, cold-like symptoms such as congestion, runny nose, or sore throat. I think COVID-19 can present a little bit more like a cold. So there's some overlap with colds. So that might be one thing that's a little stronger for COVID-19. The big one that's very unique to COVID-19 is loss of taste or smell. Okay? Now, we're also going to treat these two very similarly. So there's a lot of overlap, but there are a few additional things I would recommend for COVID-19. Before I get to treatment, we really need to talk about what are emergency symptoms. This video is going to be a little bit longer because we have to treat this section because there are people who die from both the flu and from COVID-19. And so I want you to be looking out for emergency signs and symptoms. Okay, so with the flu, could be trouble breathing, shortness of breath, chest pain, pressure, hard to wake up, confusion, dehydration, seizures, severe weakness, muscle pain. For children, fast breathing, when you see ribs that pull in with each breath, okay? Gray or blue lips or nail bed, I mean they're having poor oxygenation. No tears when crying and a dry mouth. Okay? COVID-19 is normally mild to moderate symptoms, but it can have severe and fatal consequences, and especially in elderly or people with pre-existing conditions, obesity, diabetes, things like that can really aggravate COVID-19. So things to watch out for, and they're kind of similar. Again, trouble breathing or catching your breath. Skin, lips, or nail beds that are pale, gray, or blue. New confusion, trouble staying awake or waking up, chest pain, or pressure that is constant. For children, dizziness, dry mouth, frequent vomiting or loose stools, fever that doesn't go away, trouble staying awake or waking up, being confused or agitated. So I'm going to put the websites from the Mayo Clinic for both the influenza and COVID-19 in the comments in case you want to review those. If you are concerned, is this an emergency situation? Those will be in the comments so you can review that and you can address it. Okay? All right. So it's what I'm hoping to give you here today is a naturopathic solution, treatments that you can use for treating influenza and COVID-19. So, I'd made a video on the cold, and there's also some overlap with cold because these are all viruses that we're dealing with, and they're all really respiratory viruses. So there's going to be some overlap in treatment. So anytime you get sick, anytime you're healthy, you want to drink plenty of water, but you're going to be extra good at drinking water if you're sick, okay? With that, you need to salt your food. I put a little more emphasis on drinking extra water with a cold. rest. You want to avoid sugar, sweeteners, juice, alcohol, stimulants, caffeine, that sort of thing. Usually with a flu, you don't want to eat as much as a cold. And so you don't have to eat as much. You might want to kind of fast a little bit. However, eating red meat may be helpful. I think eating beef liver can really turn things around. So those are some diet and lifestyle things you can consider. With some supplements to support you in overcoming these. Vitamin C, right at the top of the list again. These aren't just, and especially for COVID-19, these aren't just my thoughts. So I've studied Peter McCullough's protocols. So he was one of the leaders during the COVID pandemic. Did a lot of really good research and is world class. Okay, so I pulled from a lot of his protocols and I expanded them with some of these naturopathic protocols I have as well. So for vitamin C, if you're sick with the flu or COVID, I'd say take a minimum of 4,000 milligrams of vitamin C per day. You could do 5 or even 10 if your gut will tolerate it. Okay, so I like the Now brand encapsulated vitamin C with bioflavonoids. I'll, of course, include my FullScript online store link so that you can go get some of these supplements for you and your family. Next is vitamin D. I think the COVID pandemic made vitamin D famous. It was always important, but it got a lot of emphasis during the pandemic. So my 2 brands that I like for vitamin D are either Pure Encapsulations or Protocol for Life Balance. And you take 20,000 to 50,000 IUs of those. I have one that's dissolvable that works really well for kids. Works good for adults too, from Superior Source. Next, we have some special botanical blends from Professional Botanicals. Their bottles look like this, but the ones I want to highlight are Viralade. Again, great for any viral infection. If you're having a respiratory infection with any coughing or rawness in your throat, anything like that, making a tea from Viralade and adding a little bit of honey can be very soothing for the respiratory tract. So we take anywhere from 6 up to 12 Viralade capsules per day, depending on how aggressively you want to treat it and how severe your symptoms are. The other the other product from Professional Botanicals is just great, especially if you're having a lot of lung, kind of lower respiratory and mucus, like heaviness in your lungs. The product is called Lungs and Mucus. It's a 2,000-year-old Chinese medicine formula. They don't keep something around for 2,000 years unless it works really well. So I really like those ones. I'm going to do a separate video for cough, for sore throat, and sinus infections. I would say that a sore throat is especially common with COVID-19. It can really attack those tonsils and structures in your throat, but it could be in the flu also. Okay, now if you do suspect that you have COVID-19, or if you just want to be safe, there's about 3 products that you really should consider. And the first one I use from Protocol for Life Balance is Nattokinase. And Nattokinase is a blood thinner. So one of the most serious consequences of COVID-19 is blood clotting. And sometimes these can be big clots. In some cases, they can be microclots. And that's actually what causes the loss of sense of taste and smell, are these microclots. And those capillary beds are getting blocked up, and then your nerves aren't being nourished. So if for nothing else, you want to take Nattokinase as a blood thinner so that you don't get those symptoms. But again, blood clots can be fatal. They can be very dangerous, and so it can protect you from more serious consequences and loss of taste or smell. Once you lose that taste and smell, it doesn't always come back. You want to get on that as quickly as you can, ideally even before you've lost your sense of smell. Zinc chelate. So taking zinc is really significant. Again, this became very popular with the pandemic. So taking 60 milligrams per day, and I'd spread that out, do 20 milligrams with each meal. Also good for the flu, it's good immune support. It's especially indicated for COVID. Quercetin is a really important product. So Dr. McCullough's research showed that it can reduce the viral replication and possibly even your chance of getting COVID by taking quercetin. Quercetin is oftentimes used as an anti-inflammatory, antihistamine. I like Pure Encapsulations quercetin, so that's one to consider. I will talk about body aches because it's very specific, I think, to the flu and to COVID. So if you're getting body pain, muscle aches, that kind of thing, my go-to is taking calcium. And calcium is the best nutrient for pain, and especially muscle pain. And so taking 800 or 1,000 milligrams of calcium per day can really help with pain. And again, you want to spread that out into at least 2 doses. I like Pure Encapsulations calcium citrate. Calcium citrate is a really absorbable form of calcium, and so that's a great product. So those are the diet and lifestyle and supplements that I recommend for influenza and COVID-19. Then I've got a few extra, these are kind of little tricks. And I believe that these are mostly using principles from Chinese medicine and acupuncture. And so the first one says, if you're experiencing chills, tap for 30 seconds between the nose and lip. So you just tap like this if you've got the chills. Okay? Next one, if your temperature is high or if you're feeling cold, you can massage your temples for 20 seconds with your eyes closed, 20 seconds with your eyes open. Okay? And that kind of resets your body's thermostat. You can use that for a flu. You can actually even use it maybe if you're in an airplane and it's cold or something, you can do that same technique. It just resets your thermostat. Okay, the last one of these little tricks is if you're experiencing an upset stomach, nausea, or stomach pain, you can tap here on your solar plexus. So my belly button is here and the end of my sternum is here. You want to go right in between those. And you can tap that for 20, 30 seconds. And this is a great one really anytime you get nausea. Maybe you even get car sick or something like that. You can try tapping there. So there's some great things to do. With my family and with my patients, for me, taking pharmaceuticals or medications is a last resort. And so hopefully you can use some of these natural remedies before reaching for one of those. I also don't necessarily recommend that you suppress a fever. And I'm going to make another video. I actually have an older video on fever suppression. I'll probably make another one. And a fever is your body's, really all symptoms, is your body's response to this infection. It's your body trying to mount a defensive response. And so those symptoms, in many cases, can be helpful. Sometimes, like if you have a non-productive cough, it's just keeping you awake all night, and it's just not really helping. You know, some of those things we need to work with the body on. So again, I'll do another video on cough and some of those specific symptoms. But the goal is not to suppress. We want to support the body, nourish the body and help your body's immune response. So this is how I recommend that you treat influenza and COVID-19.